I know with some of the injuries that I've had, it usually hurts to touch. However, I've gone to loads of different physios throughout my career, and sometimes they actually push on where it hurts to kind of get, let's say, the flow. Is that actually the right action to take? Because it seemed mind-boggling to me how if something hurts, you kind of dig at it.
Okay, well, I think from my perspective, osteopathically, what I always do is I always look sort of at the area around either side of, or deeper or superficial from where the actual point of pain or injury appears to be. Because if you work in towards the point of injury, you start to rehabilitate everything around it, and actually that takes off the pressure and resets that fine balance we've been talking about, which
Yeah,
then allows you to get in finally into the bit where the pain is. So the idea is not, the way I'm thinking and the way I'm working is actually to provoke aggravating that tissue. It's more to activate the tissues around, the muscles around, to work better to support the bit that's actually got the issue. Yeah.
right.
Now, there are times when there is a tear and there is actual damage, but the process isn't dissimilar in a sense. You still don't want to traumatize the bit that might eventually need an injection, might eventually need other interventions. But whilst you're waiting and thinking about that, you may as well start working in that sort of targeted level round and towards, because you might actually find over that process things are getting better and better at a
Yeah,
faster and faster rate. So whatever the outcome is, you're rehabilitated or prehabilitated, ready for any other intervention, so that whatever might come, you're still in better shape than you would have been just by sitting there doing
in
nothing.
that.
At
Yeah,
the worst case, you know?
right.
At the best case, you might actually be better in full action and trust your body a bit more to continue with the rehab or remedial exercise before you return to full activity.
Right.
So there are strategies, I think, but it needs thinking through, and it's not just a one size fits all. You've got to look at each individual.